1 in 33 babies born in the U.S. this year will have some kind of birth defect. January is National Birth Defects Prevention Month, so if you're pregnant or planning to be, we wanted you to know some steps to prevent birth defects. I'm joined now by Dr. Aaron Poole. He's an OB-GYN with Las Palmas del Sol Healthcare. Dr. Poole, thank you for coming on today. What are birth defects, first of all, and are birth defects common?
Yes, they're actually more common than we think. They complicate about 2 to 4% of pregnancies, and it's when there's a structural anomaly affecting the baby. And these can range from mild to severe cases.
So then, what are some common birth defects?
Well, heart defects are the most common type. Other common things are cleft lip, cleft palate, limb abnormalities like things like clubfoot. And then also we have issues with the central nervous system, things like spina bifida.
Now, are birth defects preventable?
Yes, there are multiple causes for birth defects. So some things that can cause birth defects, it can be genetic, it can be chromosomal, where the chromosome number is off. It can be environmental. So that's where we start talking about prevention. Environmental things could include like smoking, tobacco, drugs, and also medications that may be prescribed to you. Also, we know there's risk associated to high temperatures in the first trimester, and then infections like Zika virus or toxoplasmosis that you can get from changing cat litter.
Now,
and also
even
medical
if the mom
conditions like
has
diabetes.
That's something else that increases the risk of a birth defect?
I'm sorry, I didn't hear that.
Medical conditions in the mom, like diabetes, could also increase the risk of a birth defect?
Right. So like diabetes that's not well controlled, that can lead to birth defects. So you want to optimize that prior to. So as far as prevention goes, it's optimizing your health before you get pregnant is ideal.
So what are some tips or steps that expecting moms can take to prevent birth defects?
First of all, just being healthy, being at the appropriate weight, exercising, avoiding drugs, alcohol, tobacco. As far as medications go, if you have any medical conditions, see a provider before you get pregnant so you can make a plan as far as when you should stop or if you should stop your medications. Also, you want to make sure, I'm sorry.
No, go ahead, I'm sorry.
Yeah, and then you just want to make sure that everything is ready to go and optimize. Folic acid is also really important. You want to have that at least 3 months on board in your prenatal vitamins before you get pregnant, because that can reduce the chance of spina bifida.
Dr. Aaron Poole, an OB-GYN with Las Palmas del Sol Healthcare, thank you very much for your time today.
All right, thank you. Have a great day.